Researchers have discovered a new virus in China.
A new virus outbreaks in China.
Rising HMPV cases in China.
Welcome to MH Health YouTube channel. In today's video, we talk about HMPV, or Human Metapneumovirus, a virus that's been making headlines recently. From what it is, to symptoms, how it spreads, and what you can do to stay safe, let's explore everything you need to know. Human metapneumovirus. A respiratory virus first identified in 2001. It belongs to the same family as RSV, respiratory syncytial virus, and is a common cause of respiratory infections worldwide. It mainly affects young children, the elderly, and those with weakened immune systems. Let's discuss the symptoms of this virus. Mild symptoms, common cold-like symptoms. Runny or stuffy nose. Nasal congestion is one of the earliest and most common symptoms. Cough, persistent dry or productive cough. Sore throat, irritation or discomfort in the throat. Sneezing, common during the initial stages of infection. Fever, mild to moderate fever, usually below 102 degrees Fahrenheit or 38.8 degrees Celsius. Fatigue, general tiredness or lack of energy. Headache, mild headaches are possible. Moderate symptoms, progression of respiratory issues, shortness of breath, difficulty breathing, especially during physical activity. Wheezing, whistling or rattling sound while breathing, indicating airway inflammation. Chest congestion or discomfort, a feeling of tightness in the chest. Loss of appetite, reduced desire to eat, often seen in young children. Severe symptoms, common in high-risk groups. Bronchiolitis, inflammation of the small airways, leading to rapid, shallow breathing. Nasal flaring retractions, pulling in of the chest with each breath. Cyanosis, bluish tint to lips or fingertips due to low oxygen levels. Pneumonia, lung infection with symptoms such as high fever, severe coughing, chest pain, difficulty breathing. Hypoxemia, low blood oxygen levels causing confusion or lethargy. Severe dehydration, due to difficulty in feeding or drinking, especially in infants and elderly. Symptoms in specific group, infants and toddlers, poor feeding or difficulty breastfeeding, unusual irritability or lethargy, severe wheezing or labored breathing. Elderly adults, exacerbation of underlying chronic conditions like asthma, COPD, or heart disease. Increased risk of hospitalization due to complications like pneumonia. Immunocompromised individuals, prolonged infection with more severe symptoms. Increased risk of secondary bacterial infections or worsening of existing respiratory conditions. How HMPV spreads. HMPV is a highly contagious respiratory virus that spreads in several ways, primarily through close contact and respiratory secretions. Here's a detailed breakdown of how it spreads. Respiratory droplets. Primary mode of transmission. When an infected person coughs, sneezes, or talks, tiny droplets containing the virus are released into the air. These droplets can land in the mouths, noses, or eyes of nearby individuals. Be inhaled into the lungs, leading to infection. Direct contact with infected individuals. Close physical contact, touching or being in close proximity to an infected person, such as hugging or shaking hands, can transfer the virus. Contaminated surfaces, fomite transmission. Touching surfaces. HMPV can survive on surfaces like door handles, tables, and railings. Toys, clothing, and other personal items. Close and crowded environments, high-risk settings. HMPV spreads more easily in schools and daycare centers, hospitals and long-term care facilities, public transportation, and crowded events. Preventing the spread of HMPV. Practice good hygiene. Wash hands regularly with soap and water for at least 20 seconds. Use hand sanitizer if soap is unavailable. Avoid close contact. Stay away from people who are sick. Maintain physical distance in crowded spaces. Use respiratory etiquette. Cover your mouth and nose with a tissue or elbow when coughing or sneezing. Dispose of tissues immediately and wash hands. Stay home when sick. Isolate yourself if you have symptoms to prevent spreading the virus to others. Should you be concerned? While the recent surge in cases is unusual, experts emphasize that HMPV is not as contagious or deadly as COVID-19. Staying informed, practicing good hygiene, and seeking medical care for severe symptoms are key to managing the risk. Role of vaccines and treatment for HMPV. No approved vaccine yet. Currently, there is no specific vaccine available for human metapneumovirus. However, research is ongoing to develop vaccines to protect against the virus, especially for high-risk groups such as infants, the elderly, and immunocompromised individuals. Prevention. While vaccines are in development. While waiting for a vaccine, the focus is on prevention through good hygiene practices, regular hand washing, avoiding close contact with sick individuals, disinfecting frequently touched surfaces, wearing masks in crowded or high-risk settings. Thanks for watching. If you found this video helpful, don't forget to like, share, and subscribe for more health updates and tips.